All right, 5 days. That's how long Congress has to figure out if and how they're going to fund the government, short term or long term. And at the center of that debate is Obamacare, the Affordable Health Care Act, the very same health care law controversy that led to a government shutdown a dozen years ago. Back then, congressional Republicans wanted to gut the whole thing, which didn't happen eventually. But this time, congressional Democrats, they want to see the access to it continue by extending the tax credits that help millions of Americans cover the cost of it. Those are set to expire at the end of this year. And if that happens, tens of thousands of Idahoans could see what they pay for health insurance double. Hunter Funk looks at why some in Washington want to see those tax credits gone and why others say without them, many Idaho families will likely just let go of health care.
According to Families USA, about 100,000 Idahoans rely on enhanced healthcare tax credits to keep their insurance affordable. Those credits were expanded during COVID, but they're set to expire by December 31st. And the deadline for Congress to extend those tax credits is September 30th. If Congress doesn't act, families will start seeing higher prices in renewal notices starting October 15th. Idaho Congressman Mike Simpson says it's time to see it go.
It allows for someone who makes up to $140,000 a year to get tax credits for health care. This pulls it back to what it was originally intended by it expiring and stuff. It doesn't eliminate all the tax credits, just for those upper income groups that they'll lose that subsidy for their health care.
The threshold, if the health care tax credits are not extended, would revert it back to the 100% to 400% federal poverty level income range. For example, a single person with an income above $62,600 would lose all subsidies, and a family of four with an income above $128,600 would lose all subsidies as well.
I support repealing it. If we extend it, it's $350 billion over a 10-year period. And in fact, I think it's probably ended up more than that. The last I heard was $40 million just to extend it for a year. So that's going to be very, very expensive. And at a time when we're trying to reduce the deficit and get away from this $2 trillion annual deficit and this $37 trillion debt, we've got to head this country in a different direction.
Advocates say letting the credits expire will push premiums through the roof.
The expiration of the enhanced tax credits mean an average increase of 75%, and for many, a doubling or tripling of their costs.
Pat Kelly with Your Health Idaho says the impact will hit rural families the hardest.
We expect about 25,000 Idahoans to cancel their coverage. These are ranchers in eastern Idaho, farmers in northern Idaho, and small businesses all across the state who will have to make a gut-wrenching choice: invest in their business or choose health insurance.
Simpson insists the tax credits for lower income families will remain, and the ripple effect it could bring to rural hospitals has been considered.
As you can imagine, in Idaho, that's a big deal. And we put in the Working Families Tax Cut Bill, or the One Big Beautiful Bill, as we called it back then. We put in a provision for $50 billion to be used for rural hospitals to keep them afloat. Nobody wants to close the rural hospitals and stuff. And I've talked to several of them, and they say, yeah, we'll be okay. It might mean we have to do business a little differently and that kind of stuff, but that's okay. We ought to re-examine how we do everything in this country, frankly, to find out if we can do it more efficiently and effectively.
But with open enrollment starting, advocates warn thousands of Idahoans could be priced out of coverage if Congress doesn't act soon.
The real challenge is simply having to make really tough choices, and I think those are exacerbated in rural areas. The decision in those areas, particularly in agriculture and ranching, is you can invest in your business or you can invest in your healthcare, and I think there's going to be really tough decisions, particularly in those rural areas. Their cost increases are a little bit higher on a percentage basis than the more urban areas that we have in Idaho.
And just asking Congressman Simpson about what it's looking like, whether it will be or won't be, he's expecting it potentially to not be extended.
Because it's all wrapped up in this debate over funding the government, which has to happen by September 30th. Mm-hmm. And he thinks that will go into government resource or recess after that because of that. So, all right.
Exactly.
Interesting. 62,600 was what somebody will have to lose. Will lose those subsidies if they make that much, or
just a
more?
little bit above that, yeah, if they make more than that.
To live comfortably in Idaho, we just did a study, $96,000 a year. So there's quite the disparity there. We'll be right back.